Good evening students. Now we will see the applied aspects in respiratory system. You remember like this. First is pleura. Okay, inside the pleura you have lungs. So what is in between the two pleura, visceral and parietal pleura? In between you have the pleural fluid. If the pleural fluid is normally very minimal. If there is excess fluid accumulation in the pleural space, it is called pleural effusion. And if excess air is accumulating in the pleural space, it is called pneumothorax. Now coming to the lung you can divide like this: parenchyma and airway. So parenchymal disease are mostly the occupational lung diseases, and that causes parenchymal infiltration, and that leads to restriction of the lung movement. That is also called as restrictive lung diseases. So whatever disease affecting the lung, they can be called as restrictive lung diseases, and the most common example is pneumoconiosis occurring in coal workers, asbestosis and bagosis. These are the occupational lung diseases. And coming to the another infection of the parenchyma, that leads to cavity formation. That occurs in tuberculosis. Okay, so tuberculosis is caused by Mycobacterium tuberculosis bacteria that causes infiltration and infection and cavity formation in the lung parenchyma. Then you remember the coming to the airway. If the airway is narrowed, it is called obstructive lung diseases. Example are asthma, or they are grouped as chronic obstructive lung diseases or pulmonary diseases. And if the airway is very narrow, it leads to less air entry into the alveoli, and it causes collapse of the alveoli. Next, you remember in the alveoli we have a substance called surfactant. So deficiency of surfactant leads to respiratory distress syndrome. Okay, if it is present in infant, it is called infant respiratory distress syndrome, because surfactant is very important to reduce the surface tension. And coming to the alveolar capillary membrane, okay, in the next structure, when there is a fluid collection, it is called pulmonary edema. Okay, so it affects the diffusion of gases. Now as a whole, when the lung hyperventilate, what will happen? More carbon dioxide will be washed out, and it causes a condition called respiratory alkalosis. When the lung hypoventilate, what happens? Carbon dioxide will be retained, and it leads to respiratory acidosis. So these are some of the applied aspects in respiratory physiology. Thank you.